This is a production of West Virginia Public Broadcasting.
Support for the Legislature Today is provided by West Virginia University, offering education, healthcare, and the opportunity to achieve career success since 1867. Information at wvu.edu. Embassy Suites by Hilton Charleston, an all-suite hotel and conference center minutes from Yeager Airport and Capital Markets. Reservations and brasserie dining information available at hilton.com.
Solar Holler, supporting Appalachian communities and building on West Virginia's history of powering the nation by bringing solar energy and battery backup to homeowners, nonprofits, and businesses throughout the region. More at solarholler.com.
Welcome to the Legislature Today. I'm Curtis Tate. The House of Delegates is reviewing a spate of bills that would affect the electoral process in West Virginia. Jack Walker spoke with delegates on both sides of the aisle about some of the bills proposed so far.
I'm here just outside the state capitol rotunda. We're coming out of an election year, and many members of the West Virginia House of Delegates have proposed pieces of legislation that would reform the electoral process. But not all of these bills have received bipartisan support. That includes House Joint Resolution 13, proposed by Delegate Scott Heckert, a Republican from Wood County.
Next election, that resolution would let residents vote on an amendment to the West Virginia Constitution. That amendment would clarify that non-U.S. residents are prohibited from voting in West Virginia's elections.
The Vice Chair asked to move to consider the proposed committee substitute for the resolution in lieu of the introduced version. Is there any discussion? If not, all in favor, please say aye. Aye. All opposed say nay. The ayes appear to have it. The ayes do have it. The motion is approved.
But non-citizens are already prohibited from voting. So some Democratic lawmakers and outside interest groups have said the resolution wouldn't accomplish much. Julie Archer is the deputy director of the West Virginia Citizen Action Group. Her organization lobbies for progressive policies surrounding healthcare, environmental conservation, and democratic protection.
The fact of the matter is that non-citizens voting is already illegal in all 50 states. It's illegal under federal law, and a non-citizen could go to jail for up to 5 years just even for registering to vote, and that's a deportable offense.
The resolution has been referred to the House Rules Committee and awaits further review.
Plus, House Bill 2400 was proposed by Delegate Rick Hillenbrand, a Republican from Hampshire County. That bill would prohibit the mailing of unsolicited absentee ballot applications.
Hillenbrand said during the election, some outside interest groups mailed residents absentee ballot applications en masse. He said that could cause residents to submit absentee ballot applications they don't qualify for.
You fill it out and submit it without knowing, well, wait a minute, maybe I'm not eligible for an absentee ballot. So that's the intent of it. It's not intended to make it onerous. In fact, it's pretty easy to go do it. You can get those applications online.
Hillenbrand says his bill would bolster the integrity of an already strong electoral process in the state. But Delegate Evan Hansen, a Democrat from Monongalia County, had a less favorable view of it.
I think that bill is voter suppression, pure and simple. There's a government form that any West Virginian can download off the internet, and this bill makes it a criminal offense to distribute that form to more than 10 people to allow them to register for an absentee ballot.
The bill passed its first reading on the House floor Wednesday.
And House Bill 2117 would require mail-in ballots be received by 7 p.m. on Election Day to count. Currently, mail-in ballots only have to be postmarked by the day of the election. That bill's lead sponsor is Delegate Doug Smith, a Republican from Mercer County.
Mail-in ballots are given out in plenty of time, and waiting until the last minute that's like waiting until the last minute on Election Day to go to the polls, and you arrive at 8 o'clock, you don't get a vote.
Smith said the bill is partly informed by his own experience, voting as a West Virginia resident while stationed overseas.
I've been deployed when I was in the military. I was in Iraq, got my ballot from West Virginia, and got it in before it was even due. So it can be done.
But Delegate Hansen worries that bill could take the right to vote out of some residents' hands.
The one thing that a voter can control is when their absentee ballot is postmarked. What they can't control is when it gets delivered by the Postal Service. And I have concerns with this president potentially going to be messing with the United States Postal Service and firing our federal workers, that we won't be assured that an absentee ballot arrives on time.
Overall, Archer says her group worries that most bills coming out of this year's legislative session add restrictions to the electoral process instead of making voting easier.
They also want to, continue to use, the big lie that the election was stolen to justify restrictive voting policies.
But Hillenbrand says re-examining the electoral process is part of protecting democratic institutions.
Well, I think we all want fair, open, and trustworthy elections. That's what we're all seeking here. And again, West Virginia, I think we're doing pretty good these days.
The House Judiciary Committee has sent House Bill 2117, the mail-in ballot deadline bill, to the markup and discussion phase. For the Legislature Today, I'm Jack Walker at the state capitol.
Nearly every day, each chamber's finance committees have been holding hearings with testimony from different agencies, organizations, and branches of government. Today, the House Finance Committee held a hearing on the Public Employees Insurance Agency. Brianna Heaney has that story.
The Public Employee Health Insurance Agency, or PEIA, presented their 5-year plan to the legislature. The plan asks for around a $100 million bump in funding from the legislature. It also raises premiums, copays, and deductibles for users by a pretty substantial amount. Users can expect premiums to rise by 14 to 16%, deductibles to rise around 40%, and copays by around 100 to 150%. Jason Haught presented the plan to delegates.
We will be increasing premiums at an estimated $29.9 million for the non-state fund. The next row is deductible and out-of-pocket. So we've made some benefit changes this year to the plan, substantial. The value estimated for the state fund of deductible and out-of-pocket increases is $23.7 million.
Spousal surcharges for those who don't have access to health insurance through their workplace are also going up, which, according to Haught, will mean less users.
Lots of people did. This was a big move. This was a big impact on the plan, and it's about to get bigger because after analysis of the first year, we did increase the spousal surcharge substantially. It's going to be going up to $240, $250.
He says this increase will help the state save on the program through increased revenues from the increased spousal charge and the assumed cost reduction of those that leave the plan. Haught told legislators the major cost driving down the bottom line across the healthcare industry as a whole is pharmaceuticals.
I first started with the plan. Drugs made up about 10% of our overall plan spend, possibly 15%.
Now, Haught says pharmaceuticals account for 25 to 30% of the budget, around a 10% increase, which Haught says equals hundreds of millions of dollars.
This is a billion-dollar plan. When you apply a 10% change, that is a very, actually, not even what the trend is currently in healthcare. Healthcare trend the last few years has been startling. On all sectors, retiree and active. So, 10% of $1 billion is $100 million. So that kind of puts into perspective when you talk about a percent, you talk about 5%, you talk about 10%. We're not talking about a $500,000 line item. We're talking about a $1 billion line item.
Delegate Matthew Rohrbach, a Republican from Cabell County, is also a practicing doctor. He says the key to relieving the financial obligations of the state to PEIA and the cost to users is to get pharmaceutical cost down. But he says the state can only do so much on this, and it's going to take an act of Congress, literally, to do this.
There's no question that most of the relief that's going to be had on pharmaceutical cost is going to be from the federal level. And that does appear to be one of the few things there's actually very bipartisan support on in Congress. is I think the whole country is tired of these just massive increase in pharmaceutical cost.
For West Virginia Public Broadcasting, I'm Brianna Heaney at the Capitol.
It's Disability Advocacy Week at the state capitol. Groups that advocate for residents with disabilities across the state have visited Charleston to talk about their needs and legislative priorities. Jack Walker stopped by and brings us this report.
CDC figures from 2022 estimate that 1/3 of West Virginia adults have some form of disability, ranging from vision or hearing difficulties to mobility needs and cognitive disabilities. Disability right advocates in the state say investing in folks with disabilities serves a dual purpose. It helps all West Virginians have a higher quality of life, and it also helps residents with disabilities find work and rely less on state programs, reducing spending. Nita Hobbs is Deputy Director of the West Virginia Association of Rehabilitation Facilities, which oversees West Virginia's state use program. That program gives participants with disabilities priority over some state-requested jobs, like janitorial work and mail processing. Hobbs wants the program to have its preferred purchasing status reinstated, which would prioritize residents with disabilities in certain hiring processes. The status was repealed in 2022, and Hobbs says since then, the program's participants have faced barriers finding work.
So instead of going and spending money in their local community, becoming taxpayers, becoming self-sufficient, they're then out of work.
Tina Weissman is Executive Director of the West Virginia Developmental Disabilities Council. She said investing more in behavioral health resources across the state could help folks with disabilities lead more independent lives.
You invest in people with disabilities living in their communities, invest in supporting them to get jobs. It all comes around like full circle in supporting that community.
Disability advocates will be visiting the state capitol through Friday and say residents and lawmakers are welcome to stop by and learn more. For the Legislature Today, I'm Jack Walker at the state capitol.
Earlier today, Eric Douglas sat down with Senator Tom Takubo, a Republican from Kanawha County, and Delegate Matt Rohrbach, a Republican from Cabell County, to discuss the legislation aimed at providing exemptions to childhood immunizations. Both are physicians.
Welcome to the Legislature today, gentlemen. I appreciate you joining me today. Delegate Matt Rohrbach from Cabell County, Senator Tom Takubo from here in Kanawha County. The main reason we're here today is because you're both physicians, and I wanted to get your scientific perspective on the bill currently moving its way through the legislature. It's in the House side now to institute exemptions to the childhood vaccine rules. I actually kind of got a news notification just a moment ago that you're both aware of the vaccine outbreak in Texas. About 120 people now, 9 counties. A child has actually died as of today. And to me, that kind of kicks off where we're talking about. So probably Delegate Rohrbach, if you'll start, but kind of give me your two-minute version of what this bill does.
Well, the bill, as proposed, does several things. One of the things it does is it creates a cause of action against a private school that wants to uphold vaccine standards and an individual's denied entrance into that school solely for that reason. Then it basically allows for a philosophical or religious exemption to being vaccinated. Now, the cause of action part is very troubling because we were suddenly going to really put a private school that would still want to adhere to the current vaccine policies, or perhaps a vaccine policy that they would originate. That would really put them in quite an awkward position legally. And I feel pretty certain that that part will not survive in the House of Delegates.
Interesting. So this bill originally came from the governor's office, went through the Senate. It was amended a couple ways in the Senate. You think you're going back to the governor's original bill, or just that portion will be?
Well, we'll see where we wind up.
Right. Well, fair enough.
But I don't think anybody is looking to make a principal of a private or parochial school liable for something they shouldn't be liable for legally. So that part's, I think, among other things, is going to come out of that bill.
Senator, I think you alluded to it, or maybe I don't want to put words in your mouth, but I think you alluded to it the other day, that we have one of the lowest vaccination rates from 0 to 5, but one of the highest vaccination rates of children at 5 years old and up, because of the current laws that say that children must be vaccinated before entering school. Is that your understanding as well?
Yeah, that's correct. This bill's been touted as a religious freedom bill, and one of the things that people's got to understand, vaccines is probably one of the greatest accomplishments in medicine. For 70 plus years, if you look at West Virginia, when's the last time you ever heard of a preventable illness being spread through West Virginia? We've done a wonderful job protecting our children. And when you look at the statistics, 42% of children in the state of West Virginia are oftentimes being raised by a non-biologic parent because of the drug epidemic and other reasons. So many times these individuals don't have healthy immune systems either. So it's not just protecting the children, it's protecting those taking care of those children. And when you look at the CDC map, those vaccines have done such an incredible job. They just don't happen here. Every state around us that has laxed these policies have suffered what Texas is going through right now. Virginia had some deaths of some children with group B meningitis just, I believe, last year. So, it's hard for me to understand why we want to take such a draconian step backwards and put all the lives of our West Virginians at risk. There's a lot of talk in the news about walls and protection, and I certainly believe in that. But West Virginia has another strong wall that protects the people of West Virginia against preventable, and that's the key thing. We're talking about childhood immunizations, preventable disease that our kids just don't have to suffer. There's so many things that children in West Virginia have to worry about. Dying from a preventable disease shouldn't be one of them.
It's interesting when you see the maps of even RSV and some of the other illnesses going around, flu, whatever. Often West Virginia is kind of a low area, and then every state around us is higher, and I assume it's because of some of those childhood protections and that sort of thing.
Yeah, we have incredible herd immunity. So people often will say, well, if you want to take a vaccine, you go take a vaccine. If I don't, that's fine. But I said on somewhere the other day that if the entire world got infected with COVID on day one, everybody at the same time, COVID would have been over in a matter of weeks to months. The way all these things work is they find the sickest, most vulnerable person to jump to. And if everybody around you has a strong immunity, it has nowhere to jump and it immediately dies, and that protects the population. That's why herd immunity is so incredibly important. That's why we need to keep those vaccination rates as high as possible.
Delegate, I did a little research, and I don't mean to throw numbers at you, but I did a little research. The federal organization is the Health Resources and Services Administration. Mm-hmm. That's who pays when there's a demonstrative injury to a vaccine. According to their statistics, just in the payments they've made out over the last X number of years, it's literally 1 in a million people. I've heard a lot of talk at committee hearings and that sort of thing about vaccine injuries. But according to the federal government's data, it's literally 1 in a million people get some level of injury. I think a lot of those are anaphylaxis, that sort of thing. But I don't know if you were in it. There was like a 5-hour health committee meeting the other day in the House to discuss a lot of it.
For every minute of it.
Fair enough.
And I just hope that people will follow the science. Are there rare but unfortunate complications of vaccines? Yes, just like there are from blood pressure vaccines, cholesterol medications, all of those things. That's an unfortunate part of medicine and life. So to say that there's not an occasional complication would be mistaken. If there is a way to predict who would have those in advance and prevent them, great. I don't have any problem with that. Nobody wants to cause kids undue pain and suffering. Sure. But at the end of the day, polio, measles, mumps, rubella, these things are real diseases, and they do also cause pain and suffering. So I hope that we can look at the established science and decide which direction to go, because I think that will really solve most of the problems. If we really can narrow this down and look very aggressively at what did history teach us? What happened when we had all these diseases? Now, people say, well, but if we just have 2 or 3 or 4% of the people not get vaccinated, won't be a problem. The problem is if that, and that's true. It'll be a problem for those people if they'd ever go to an area and get infected. But as you gradually watch the vaccination rate just slip away, perhaps a fair way to do this would be some type of a trigger mechanism. You know, if our vaccination rate slips below a certain amount, then the situation has to be relooked at. I think there are ways that we could solve this conundrum that we're in, but to just say, well, we're basically, nobody's got to get vaccinated forever and a day, then you better take a look at what happened back in the 30s, the 40s, before we had these things. And I think that'll really tell you the direction we need to go.
When I was doing some research, one of the things I noticed, again, talking about vaccine injuries, but was that they said nobody really worried about vaccine injuries before probably the 70s, because they were so afraid of the diseases that they fought, whether measles or whatever, or polio, that they said, you know what, we're just going to ignore that and just, we're going to fix the problem and then go backward to it. So it's really more of even a relatively recent thing that people are even worried about injuries. But you're talking about percentage of people unvaccinated. I believe I've seen, and please correct me if I'm wrong, but again, back to Texas, they're looking at about an 84% vaccination rate in the area. So we're not talking, it's not dropped to 50% though. It's still most of the people are vaccinated, but 15-16% unvaccinated is enough to cause a problem, is enough to spread through the community.
Yeah, that's right. So if every disease is different, if you take measles, for example, about 9 out of every 10 people that's exposed to measles that have a weekend will get it. And so the herd immunity for that particular disease is about 95%. So when you start dropping below that, and an outbreak occurs, it will find weakened individuals to be able to jump to and cause damage.
Okay. Gentlemen, we're about out of time, I think. So any thoughts moving forward? Delegate, it's in the House now. It's on your side.
Well, we took about 5-6 hours of testimony this week, and we're not sure when that bill is going to be brought up for the next consideration. There will be some amendments, I think, particularly the cause of action against a parochial school, because they've already come out pretty strongly in favor of vaccination. Creating a cause of action against them, I just don't think is, forget the science, I just don't think we're looking to turn a parochial school into victims here because they want to do something different than what somebody else wants them to do. So there are going to be amendments.
Last minute?
Yeah, I would just hope that the House takes a strong look at that. This whole bill is premised on religious freedom, but yet the religious schools are saying, let us choose. It's in our beliefs, it's the tenets of our belief to vaccinate and to protect the whole. So if this is truly about a religious freedom bill, then you should respect those they're asking for their freedom to make choices for themselves.
Thank you, gentlemen. I appreciate your time. Hope to have you back later on in the session. We've got a lot more to talk about.
Yeah, happy to be here.
We're here every day.
That was Senator Tom Takubo and Delegate Matt Rohrbach speaking with Eric Douglas about childhood vaccine legislation currently making its way through the legislature. That's it for tonight. Thank you for joining us. Catch the Legislature Today Monday through Friday at 6 p.m. And remember, West Virginia Public Broadcasting covers the session daily in our radio news program, West Virginia Morning, and on our news site, wvpublic.org. We also broadcast the daily floor sessions of both the House and the Senate on the West Virginia channel. I'm Curtis Tate. Good evening, and see you here again tomorrow.
Support for the Legislature Today is provided by West Virginia University, offering education, healthcare, and the opportunity to achieve career success since 1867. Information at wvu.edu. Embassy Suites by Hilton Charleston, an all-suite hotel and conference center minutes from Yeager Airport and Capital Markets. Reservations and brasserie dining information available at hilton.com.
Solar Hauler, supporting Appalachian communities and building on West Virginia's history of powering the nation by bringing solar energy and battery backup to homeowners, nonprofits, and businesses throughout the region. More at Solar